Dreams. We're all born with them. Dreams of adventure, of finding a sense of purpose, meaning, of reaching our full potential. And wherever your dreams take you, your journey starts with UAC.
I'd like to begin by acknowledging the traditional owners of the land on which we meet today and pay my respects to elders past, present and emerging.
Hello and welcome to Let's Chat Health Science. Today we're going to have a panel of experts talk to you about health science degrees, and we're going to get a little bit of information about, entry requirements and things of that nature. My name's Trudy Noller, Community Engagement Manager at UAC, and with us today we have Elspeth Fruit, who is the Deputy Dean of Health Science at ACU. We also have Dr. Alyssa Beat, Undergraduate Director of Psychology. We've got Ben Marks, who is from the University of Canberra in Domestic Recruitment, and Associate Professor Daphne James from the University of Newcastle. And I welcome you and thank you very much for coming today. Health science. It covers a lot of areas. It covers courses such as exercise and sports science, dental science, oral health, speech, occupational therapy, clinical science, psychology, paramedicine, nursing, and so much more. And we do have lots of students who, of course, apply for health science. In New South Wales last year, it was one of our main course areas or study areas that students applied for, which is really fantastic. But we really want to know a little bit more about these courses. We do get lots of questions here at UAC, wanting to know about content and so forth. So hopefully today, our panelists are going to be able to help you, or at least give you some information around these courses. One thing I'm going to start with, however, is health science selection criteria. As we know, for a lot of health science degrees, they're highly competitive, but is it just based on the ATAR? And I think we'll start with University of Canberra. Ben, could you tell me, is it just the ATAR that you're looking for most of your health science degrees?
Of course, and I think that varies with every university, but at the University of Canberra, we're very pragmatic in our approach. And while the selection rank is something that is a very central component of what we look at in looking at a student's capacity for our health science degrees, we also have a range of different options as well when it comes to just selection rank. I guess I'll quickly explain with the University of Canberra about not just the ATAR, but also the adjustment factors that we have available. So we have up to 20 adjustment factors available for students, and they're available during 3 different categories. So we have the educational access scheme, and that's for students who were suffered some sort of educational disadvantage throughout year 11 and 12. We also have subject adjustments, which are about up to 10 subject adjustments are available. And that is rewarding students who have pursued subjects in year 11 and 12 that are relevant to the health science degrees. So most health science degrees will, at the University of Canberra, we will reward students that have had completed biology and performed at a particular level. And finally, we also have priority groups as well. So that includes those that identify as Aboriginal or Torres Strait Islander, and also elite athletes as well. There are a few exceptions when it comes to selection ranks. So our Bachelor of Midwifery is based off a particular set of questions, and that's assessed by a panel at the University of Canberra. And that's just given the sensitivity of the work with midwifery. So it's really important that our panel identifies students that have that certain level of maturity and understanding to be working with new mothers. And then finally as well with the Bachelor of Physiotherapy, that's the only course that we do not take into consideration subject adjustments.
Okay, fantastic. So what you're saying is that for many of your courses, but not all, the ATAR plus any adjustments are the thing that you're looking at, which I think would be fairly safe to say that most universities are looking at ATAR plus adjustments.
Absolutely, Trudy. And I think as well, when it comes to 20 adjustment factors that are offered at the University of Canberra, that can make a substantial difference to a student's competitiveness when it comes to getting into a particular course. So I think if I can give any advice to students in regards to the health sciences is really focus on those core subjects, and they can head to our website and look at the subject adjustments and actually see the particular subjects that are relevant to those courses.
Okay. Dr. Alyssa, can you, at Macquarie, can you put these courses on your application for your leaders and achievers? Like, do you look at those courses for that program?
Yeah, we absolutely do. So we have a great Leaders and Achievers program at Macquarie, including a number of our health sciences degrees, and we have a number of students that get early entry offers into these courses on the basis of that program that they take part in. So it's a very common, very popular opportunity for students to take advantage of.
Oh, that's fantastic. That's really fantastic. And, you know, I mean, the ATAR, of course, is used for all those high profile courses. And I know with a lot of health science, they are quite high profile and quite in demand. But if students can get an offer that way, that's fantastic. And I know for most of the representatives here today, they do and are involved in schools recommendation schemes and other early entry schemes. So to have health science courses involved is great, because students, of course, then can feel a little bit more at ease once their ATAR comes out. So it looks like we've got a mixture. We can do early entry, where it might be based on certain other factors, or the ATAR pathway, which might also have other factors involved as well. Can I ask now, Professor Daphne Jones James from the University of Newcastle. At your university, with some of your health science degrees, so I'm not going to say nursing because we know that they do lots of placement, but with some of your other degrees, do they have work placements opportunities that students can go on?
Yes, Trudy. So at University of Newcastle, the majority of our health science programs have placement opportunities where the students spend time in some sort of a clinical setting. Now, that could be a local health district, public hospital, it could be a private provider, community centre, or a non-profit sort of non-government organisation area. And all of our clinical degrees, so that goes from nursing, midwifery, physiotherapy, all of the other allied health degrees, medical radiation science, speech pathology, across a whole raft of them. We've got about 16 undergraduate sort of what will be called health science degrees, and they all have some components of placement out in the clinical setting, where they're able to really put their knowledge and skills that they learn at university into practice with patients and clients in that really practical setting.
So that's really good. So it's not just nursing then that has placement. I know that nursing is, for us, we get lots of questions about it, and it seems to be a very, very popular course, especially now with COVID and so forth that's happened. But it's good to hear that other health science students do get those practical components, because I suppose, you know, if they're going out to work in labs or things like that, they would need to know what goes on at that level. Elspeth from ACU, your university offers a lot of nursing, and can you just give me a little bit of information on placement for nurses? Like, do they go out in their first year? Do they go out in their first semester? How does that work?
Mm-hmm. Yes, so our nursing students go out on placement in their second semester of their first year. And one of the exciting recent developments is that we now have a new Blacktown campus that is offering nursing. So that's a great option for that community. And it's also held across a range of our campuses, you know, being a national university.
Fantastic. And do you, what other campuses at ACU have nursing? Is it?
So in Sydney, we have it at the North Sydney campus and the Blacktown campus. We also have it in Brisbane and Melbourne as other options.
As other options. Oh, that's fantastic.
And Canberra.
And Canberra. Well,
yes,
that's great. And so when they go out on placement, what sort of things do they actually do? Like, do they shadow other nurses? I'm not really sure myself.
Yeah, so they obviously go into a range of settings, you know, hospitals, but not just hospitals, and they go out with a facilitator. So they work in groups with a facilitator that is employed by the university that goes out with them onto placement. And depending on the level and the skills that they have, then they are either shadowing somebody, but right from the start they're engaged and actually doing some of the activities and roles of a nurse, which are obviously graded up as they progress through their degree.
Okay, well, that sounds fantastic. Daphne, at the University of Newcastle, you've got other degrees other than nursing, obviously. Do, let's say, for instance, physiotherapy. What happens in that case? Do they go out and?
Yeah, so pretty much all of our health science degrees have placement. The majority of them start placement in second semester of first year.
Yes.
So trying to get them out into their prospective professional areas so that they can really get a good view of what they're signing up to, what their program is going to ultimately lead to. The majority of the health science degrees are AHPRA accredited, so that when they finish, the graduates can become AHPRA registered. I'm sure same with all of the other education providers. So it's really important that the students get that experience and time working in the field, and they really are working alongside the other practitioners, whether it be in nursing, physio, medical radiation, science, occupational therapy, you know, all of those programs, they're all out there working right alongside the practitioners with the patients and engaging with the clients and patients. So very much a hands-on experience for those students. So they really get a good idea of what their profession's about and what their duties are going to be once they graduate.
Okay, thank you for that. Alyssa, I'm going to go back to you. You're the undergraduate director of psychology. Can you explain to us what the difference is between a student who studies psychology in an arts degree and students who study psychology in a health science degree?
Yeah, sure. So at Macquarie, we don't have a little bit of a different distinction to that. So we have a Bachelor of Psychology and a Bachelor of Psychology Honours degrees, and those are 3 and 4 year degrees respectively. And we also have a psychology major in a Bachelor of Arts. And the difference between the psych-specific degrees and the Bachelor of Arts major degrees is just to do with the amount of psychology that students take. So psychology is a professional pathway, just like many of the other health sciences degrees that we've been talking about. If students want to go on to become a psychologist, then they need to do the accredited degrees, which are the Bachelor of Psychology or the Bachelor of Psychology Honours. Whereas the major in the arts degree is a little bit more of like a taster of psychology, but it's not, the volume of the psychology that the students take isn't enough to set them onto that professional pathway. So if students want to go on to do further studies in psychology, maybe become a psychologist one day, then they need to make sure that they do an accredited psychology degree.
Fantastic. That's great to know, because we always get that question. I want to be a psychologist. Which one do I pick? If you want to be more of an accredited psychologist, you need to go down health science route. Is that correct?
Yeah, exactly. Yeah, make sure they're doing an accredited psychology degree.
Fantastic. That's good. Let's go to Ben. Ben from the University of Canberra. Look, what if student has a specific health science degree in mind? They really want, well, it could be any of them, to be honest, there's so many to pick from. But what happens if they don't get into the course they really want? What would you suggest a student do to get them to where they want to be? What course should they take on that's going to head them in the right direction?
Yeah, of course, Trudy. We generally recommend, instead of going into an undergraduate course, is to seek more information about our UC college. So the college has two branches for school leavers, and that is the UC Connect program, which for whatever reason a student didn't achieve the desired or the required selection rank, then they can explore the UC Connect program. And the UC Connect program is effectively the fundamentals and the essential study skills required for a student to be successful in tertiary education. And that is a 18-week program. And upon successful completion, the student can then transition into their first year of a health science-based degree. Now, to be a little bit more specific, Bachelor of Physiotherapy, the Bachelor of Vision Science, and also the Bachelor of Exercise Physiology and Rehab is excluded from that, just because they're highly competitive courses. Also within the UC College, we have the Health Diploma. Now, that's a 12-month program, and the benefit of the Health Diploma is the students are able to complete that diploma and then transition straight into their second year of a health science degree. In regards to the Health Diploma, they are somewhat limited in regards to what degrees you can then transition into second year. So it's important to speak to the UC College and decide which program is best for them. But there's definitely alternative pathways available for students to then get into their dream course.
Okay, so let's say, for instance, that their ATAR is at a good level. It's something that will get them into a course.
Yeah.
And they don't need to do the diploma pathway. Is there specific courses they probably should start at to get them into something that they really wanted?
Yeah, there's definitely that option available. And generally what we do is we work with the student to identify what particular health science degree that is, and then we try and match that with a particular degree that they can get into, and make sure that the subjects that they're studying are very similar or the same as the health science degree that they ultimately want to get into. And I'm sure this is universal across most universities, that in first year, generally, it is more generalized in nature, the subjects, covering core science components. So generally, there's a lot of crossover with a lot of subjects. The only downside with choosing a particular degree, undergraduate degree, is it's then based off GPA, and there's a certain level of academic achievement they need to fulfill in order to then be able to transition into that course.
And at UC, can you do an internal transfer once you've done some study to get you to where you want to be?
Absolutely. Yeah.
Fantastic. That's always good to know. And we always get those questions as well. Well, can I transfer? For most students, if they're transferring, it's just internal if it's in the same university. Of course, if they're wanting to go to a different university, then they would just reapply through UAC. And it's not a straight transfer in that case. It's where you would then be competing for a place at a different university, and it's still on a competitive basis. So your GPA or your WAM, whatever that your university has or accepts, they're going to be looking at that and not just your ATAR. A question, of course, to Elspeth. Can you give me an idea of what kind of degrees at your university, if that's the right word, that you specialise in at ACU? Is there anything in particular that you'd like to tell our audience about?
I think yes. There's the nursing is an obvious one, but I don't think I need to say too much about that. Our allied health programs are relatively new to ACU. They commenced in around 2011 with physiotherapy and occupational therapy 2013 and speech pathology. And so they're proving to be very popular and quite competitive to get into. But we've got great facilities for those programs. We operate them across 3 campuses. And so we operate a national curriculum, which I think is a really exciting option for students to really have that sense of being part of something bigger than just one campus. And these are really growth areas, as we know. You know, COVID has really raised our attention to the need for health programs. And so, you know, allied health, along with many of the other exercise and sports science, these are all areas that are going to be in much demand in the future. So, you know, we're very proud of those programs and, you know, getting lots of students interested.
Can I just get you to clarify what allied health actually means?
Yes, so I guess that's a term that's been around for a long time in relation to, particularly though, to occupational therapy, speech pathology, and physiotherapy. Really, in the health system, are referred to as allied health because they are aligned with other health disciplines, but we're not situated within medicine, for example. So nursing and medicine have, have a medical model that they operate on, and in allied health, we don't operate from that perspective, and so allied health is a better descriptor of those programs.
Oh, well, that's really good to know, because I know there'd be lots of people out there that would ask the same question. So I'm really glad we clarified that. Alyssa, could you give me some information about what Macquarie has on offer, whether there's something that you, of course, specialise in there?
Yeah, sure. So we have a really strong health sciences program at Macquarie. We've got 7 different undergraduate degrees that would fall under the umbrella of health sciences. And we're situated in the Faculty of Medicine, Health and Human Sciences, and we bring a very interdisciplinary approach. We have a very close connection between all of our degrees. So as well as the medical programs and clinical science, we also have speech and hearing sciences. We've got human sciences and chiropractic, and my personal favourite, psychology, and also cognitive and brain sciences. So psychology and cognitive and brain sciences fit incredibly well together. A lot of students take those as double degrees because cognitive and brain sciences, it's a very, very special degree. It's the only one of its kind in Australia. And it gives students the opportunity to really explore the human mind and the human brain, to learn data science and neuroscience, to be able to apply those kinds of skills. And then coupling it with psychology gives students the understanding of the human being in its entirety, the understanding of human behaviour, about how people think and why they act and why they do the things that they do. So the combination of cogs and psychology is a really, really nice special pairing that we have at Macquarie.
And I know at Macquarie there's, you have a hospital on campus. Do some of your students that are doing health science do placement at your hospital or work?
Yeah, they do. Yeah. So MQ Health encompasses both the hospital as well as a number of different allied health clinics. So we have a physio clinic, we have a chiro clinic, we have a speech clinic, hearing clinic, we have psychology clinics, and all of that sits within the framework of Macquarie Health. And so a lot of students do those practical placements both at the hospital or the specific clinics on campus, as well as a range of different off-campus opportunities as well. So we're very well set up. And every single one of our degrees has practical placements built into it. So it's an opportunity that every single one of our students gets.
That's fantastic. That's really good. Ben, I'm going to go back to you at UC. Tell me, what do you specialise in down there? And
I'd love to just choose one, Trudy, but I think by and large, the health faculty is our bread and butter at the University of Canberra. We have some really strong sports degrees with the Australian Institute of Sport just down the road, about 500 metres from our main campus in Bruce in Canberra. And we also are very strong in regards to the allied health professions. So we have also a hospital on campus now as of 2019. And a lot of our students will utilise that for their professional development. We also have a $15 million health hub and a whole range of different facilities for all of our health students. So again, going back to our sports area, we have an environmental chamber, which our Australian Institute of Sport athletes utilise, and also a number of professional sports teams, such as the Brumbies. and they'll utilise that chamber to prepare for upcoming events. So I guess in summary, the sports degrees are very strong at the University of Canberra and also our allied health professional degrees.
Fantastic. So if you're a budding sports person out there who wants to do a health science degree, UC could be the place to be. I'm going to move on to Daphne now from the University of Newcastle, and I've always heard great things about a lot of your health science degrees. So could you tell us a little more about what you have on offer there?
Sure. We've got about 16 undergraduate health science type degrees. So that includes, as I said before, we have nursing and midwifery that are run, and we have 2 campuses where we're offering those programs and some of our other programs. So both at Callaghan, which is in Newcastle, and then we have a campus which is situated at Arimba, and we've got a new building at the Central Coast at Gosford where the medical school will be extended. So and nursing students will be embedded down there. So that's going to be really exciting for mid-year and then into next year with students, more students being able to study at Gosford, which is great for that Central Coast area. We have oral health therapy and podiatry and the Bachelor of Community and Public Health at our Arimba campus. And the Bachelor of Public and Community Health is the only university undergraduate program in Australia that is designed using the big picture design principles. So that was a really exciting program that we started 2 years ago, and it's doing really well. So particularly for students who haven't got an ATAR and have been at schools with big picture design, that's a great opportunity for them to get into a health area. At Callaghan, we have our medical radiation science degrees. So we run all 3 professional areas, so diagnostic radiography, nuclear medicine, and radiation therapy. And we've been running those for over 25 years. And we have excellent facilities for on-campus laboratories and simulation. And then the students go out and do their placements to sort of add on to that. And we're in the process of building some new labs as well. Physiotherapy is one of our flagship programs that again has been running for well over 20 years. Very high ATAR, very high demand, and excellent facilities at our Callaghan campus. We also have nutrition and dietetics, occupational therapy. We also have pharmacy, which is relatively new to our university as an undergraduate program. And we have exercise sports science, which is run from the Arimba Central Coast campus, and speech pathology and psychological science. So we've really got a very large sort of portfolio of health and health science type degrees, as well as medicines, which brings it all together.
Fantastic. I know that I've been up to the Callaghan campus and done a tour myself when I was there for some work. And I saw the virtual classroom, so to speak, with one of your health science degrees in action. Mm-hmm. Can you tell the audience a bit about that?
So I think maybe you're referring to the radiation therapy.
That's exactly what it was.
Yeah.
Yes.
So it's essentially for radiation therapy, they use what they call a linear accelerator, which is a very high energy X-ray machine that's used to treat cancer. And they have a suite here at Callaghan, and all of the universities that run radiation therapy across Australia have the same suite. There was a government drive to put these into the universities a few years ago. And essentially it's a 3D linear accelerator, because to actually have a linear accelerator on site would cost millions of dollars to set up and run. We have a cancer centre very close. It's probably 5-10 minutes walk away from here. But this provides the students with the opportunity to learn how to use a linear accelerator whilst they're in that virtual experience. So, you know, they can do things. If they make a little mistake, they're not going to actually damage or harm their patient, which is really good for them to be able to practice with. And then it gives them that opportunity then to translate that virtual learning when they go into their placement. But we have lots of other virtual experiences for oral health therapy. We've developed a virtual reality program where they can do drilling in cavities, fixing teeth. I'm not exactly sure, it's not my area of expertise, but, you know, using virtual reality, and it's a really excellent simulation area for students to expand their skills and really make sure that when they go out on placement and they're actually with a real live person and performing procedures, that they're well prepared prior to that.
And that's fantastic, you know, because it is a scary thing having to actually deal with people when they're in sometimes in a real health crisis. So it's fantastic that students get these opportunities to learn to do these things with knowing they're not going to hurt anybody. So great. A question to you. Do all health science students have to do the criminal check and adhere to the New South Wales health regulations, you know, with immunisation and things like that?
At the University of Newcastle, it depends on the degree, but the majority of them, yes.
Yes.
So any of the programs where they're actually going to go out into a clinical setting.
Yes.
I'm not sure about the exercise sports science one, whether they have to do the New South Wales health verification, which requires them to have vaccinations and some other checks, but certainly. The majority of the other programs, yes, they have to do that before they can go into a clinical site.
So do they have to do it before they actually start the degree with you, or during that time?
No, before they go out into their clinical site. So usually we inform them of the requirements once they've enrolled, and then they usually have first semester to get all of that done if they start their placements in second semester of first year.
And Elspeth, at ACU?
Yes,
Yes,
so it's the same. So New South Wales Health requires anybody going into a New South Wales Health setting for a clinical placement to have all of those requirements. And so there's a sort of a minimum standard that all students need to have wherever they go on placement. But certainly New South Wales Health require a whole raft of things. And it is quite a lot of work getting all that together. So it's great that if prospective students know that that's required if they're going into a health science program, and can start to get onto that early and start working their way through the paperwork.
Fantastic. That's really good for us to know. It is a big part of, you know, going out onto placement, as you said. So, you know, if students are aware of it prior to starting their course, they can, you know, get that underway even before they start, which is great. We've had fantastic conversation and fantastic information from our universities today on their health science degrees, and of course some of the things that you might not have known about, like you have to have a criminal check, and of course adhered by New South Wales health regulations. So that's really good to talk about. I want to thank all of you today for being here with us. I really appreciate your time. I'm sure our prospective students will love the information that they've got, and I thank you, the audience, for coming and listening to us talk today. Thank you very much.
UAC represents many institutions across New South Wales and the ACT. The universities featured in today's webinar are a small selection of the many institutions which offer the courses discussed today. Students should research all university offerings so they can make informed decisions regarding their future study.